Now, the world passes a grim milestone with global coronavirus cases setting an all-time daily record on Monday with more than 1.4 million recorded infections just in one day. And this comes a year after vaccines started rolling out, 2 years after the virus first emerged. The 7-day rolling average of cases is at 841,000, which is up a whopping 49% from just a month ago when the Omicron strain was first identified. U.S. health officials now responding with new guidance shortening the recommended isolation time for those with COVID who are no longer experiencing symptoms. The new isolation period is 5 days. That's half of what it was. After isolation, people with COVID are still required to wear a mask for another 5 days when they're around other people. How health officials are going to police those guidelines is still a big question. So joining us to discuss is Bloomberg News healthcare reporter Emma Court. Emma, welcome back to Quick Take. So excited to get your input on this. I want to start on these new guidelines from the CDC. Obviously getting some backlash this morning from health experts who say that 5 days just isn't long enough, even if you're asymptomatic. What can you tell us about how exactly the CDC came to this decision?
Thank you so much for having me. It's a really good question. What the CDC is saying is that they are following the science here. They're saying that the evidence shows most transmission is happening in the 1 or 2 days right before people have symptoms, and then the 2 or 3 days after showing symptoms. So they're saying we're shortening the isolation period because this is where most transmission of COVID is happening. Now, the key word there is, of course, most, right? And I suppose that the masking portion of this is supposed to accommodate the rest of the cases, right? But this is a big concern among medical experts. Are you really stemming COVID transmission if you're shortening the isolation period? And we know that means you're going to let some people who are going to transmit COVID, out of their houses. So that's a big concern. We also know that there's been lobbying by companies. We've seen CEOs of major airlines like Delta write to the CDC previous to this guidance change, asking for changes, citing issues around labor, including worker shortages. So we know that that's played a factor as well, because we've heard health officials from the government talking about it, like Fauci.
Right, of course. And I know that a lot of people have this sort of feeling, or at least hope, that if they get it this time around, it's not going to be as bad, especially if you're vaccinated. What do we know so far about those breakthrough infections and the severity of them? Is that kind of correct to be viewing this as not so bad this time around?
Yeah, it's a great question. And look, we know that vaccines are effective and they help reduce the most severe outcomes of this disease. But we also know that people can still remain vulnerable even if they're vaccinated. So if you're a young and healthy person, maybe you can feel a little bit more comfortable with taking some risks now that you're vaccinated. But unfortunately, we do know that vaccine protection may not be as helpful in certain, age groups, people with comorbidities. We know people who are immunocompromised still have a good amount of risk even when they're vaccinated. So this is part of the sort of general public health approach to COVID-19, which is to say that we know people remain at risk even when they're vaccinated, and that's why we're all kind of doing our part here, right?